Schizoid personality disorder represents a complex and often misunderstood mental health condition characterized by a pervasive pattern of detachment from social relationships and a restricted range of emotional expression in interpersonal settings. This disorder affects approximately 1% of the general population and is more commonly diagnosed in males than females. Individuals with schizoid personality disorder typically appear aloof, emotionally cold, and indifferent to both praise and criticism from others, creating a profound sense of social isolation that permeates virtually every aspect of their lives. The diagnostic criteria for schizoid personality disorder require the presence of at least 4 specific symptoms that begin by early adulthood and occur across various contexts. These symptoms include a lack of desire for or enjoyment of close relationships, including being part of a family, almost always choosing solitary activities over group interactions, having little or no interest in sexual experiences with others, taking pleasure in few activities or situations, lacking close friends or confidants other than immediate family members, appearing indifferent to praise or criticism from others, and displaying emotional coldness, detachment, or flattened emotional responses. Unlike other personality disorders that may involve dramatic or erratic behaviors, schizoid personality disorder is characterized by a consistent pattern of withdrawal and emotional numbness. The development of schizoid personality disorder appears to result from a complex interaction of genetic, neurobiological, and environmental factors. Research suggests that individuals with family histories of schizophrenia, schizotypal personality disorder, or other related conditions may have an increased vulnerability to developing this disorder, indicating a possible genetic component. Early childhood experiences, particularly those involving emotional neglect, abuse, or severe criticism, may contribute to the development of schizoid traits as protective mechanisms against further emotional pain. Some theorists propose that individuals who later develop schizoid personality disorder may have experienced environments where emotional expression was discouraged, punished, or met with indifference, leading them to withdraw emotionally as a survival strategy. Living with schizoid personality disorder creates unique challenges that differ significantly from other personality disorders. While individuals with this condition may not experience the intense emotional turmoil associated with borderline or histrionic personality disorders, their profound emotional detachment and social withdrawal can lead to significant functional impairments. They often struggle to form meaningful relationships, which can result in chronic loneliness, even though they may not consciously acknowledge or express this loneliness. Their apparent indifference to social connections can be misinterpreted by others as arrogance, rudeness, or lack of caring, leading to further social isolation and misunderstandings. In academic and professional settings, individuals with schizoid personality disorder may function relatively well in solitary roles that require minimal interpersonal interaction. They often gravitate toward careers in fields such as computer programming, research, writing, or other technical professions where they can work independently. However, their difficulties with teamwork, leadership roles, and customer service positions can limit their career advancement and professional opportunities. Their emotional flatness and lack of social engagement may be perceived negatively by colleagues and supervisors, potentially affecting performance evaluations and workplace relationships. The impact of schizoid personality disorder on family relationships can be particularly challenging for family members who may feel rejected, unloved, or frustrated by their relatives' apparent lack of emotional connection. Children of parents with schizoid personality disorder may grow up feeling emotionally neglected or questioning their own worth due to their parents' limited emotional availability. Romantic relationships are especially difficult for individuals with this condition, as their partners may feel emotionally starved and unable to establish the intimate connection they desire. Diagnosing schizoid personality disorder requires careful assessment by qualified mental health professionals, as the symptoms can be confused with other conditions such as autism spectrum disorders, avoidant personality disorder, or depression. The diagnostic process involves comprehensive clinical interviews, psychological assessments, and careful observation of the individual's behavioral patterns across different settings and time periods. Clinicians must differentiate between the social withdrawal characteristic of schizoid personality disorder and the social anxiety and fear of rejection associated with avoidant personality disorder, or the social communication difficulties seen in autism spectrum conditions. Treatment of schizoid personality disorder presents unique challenges, as individuals with this condition rarely seek treatment voluntarily due to their limited insight into their condition and lack of distress about their social isolation. When treatment is pursued, it typically occurs because of external pressures or co-occurring conditions such as depression or anxiety. The therapeutic approach often focuses on building the therapeutic alliance gradually, as individuals with schizoid personality disorder may initially appear unengaged or indifferent to the therapeutic process. Cognitive behavioral therapy can be effective in helping individuals with schizoid personality disorder develop social skills, recognize the benefits of interpersonal connections, and gradually challenge their beliefs about relationships. Group therapy, while initially challenging for these individuals, can provide valuable opportunities to practice social interactions in a safe environment. Psychodynamic therapy may help explore underlying emotional conflicts and childhood experiences that contribute to their emotional detachment and social withdrawal. Medication is not typically prescribed specifically for schizoid personality disorder, but may be used to address co-occurring conditions such as depression or anxiety that can develop as a result of chronic social isolation. Some individuals may benefit from antidepressant medications if they experience mood symptoms, though the emotional flatness characteristic of the disorder may limit the effectiveness of certain treatments. Family therapy and education can be crucial components of treatment, helping family members understand the nature of schizoid personality disorder and develop more effective communication strategies. Family members often need support in managing their own frustrations and emotional needs while maintaining relationships with someone who appears emotionally unavailable. The prognosis for schizoid personality disorder varies significantly among individuals. Some people may experience gradual improvement in their social functioning and emotional expression over time, particularly with consistent treatment and support. However, the chronic nature of personality disorders means that complete recovery is rare, and many individuals will continue to prefer solitary activities and maintain limited social connections throughout their lives. Research into schizoid personality disorder continues to explore neurobiological factors, genetic predispositions, and environmental influences that contribute to its development. Neuroimaging studies have revealed differences in brain structure and function among individuals with schizoid personality disorder, particularly in areas associated with social cognition and emotional processing. These findings may lead to more targeted interventions in the future. Prevention efforts focus on early identification and intervention, particularly in children who may be showing early signs of social withdrawal and emotional detachment. Creating supportive environments that encourage healthy emotional expression and social connection while respecting individual differences can help prevent the development of more severe symptoms. Despite the challenges associated with schizoid personality disorder, many individuals with this condition can achieve satisfactory levels of functioning, particularly in careers and lifestyle choices that accommodate their preferences for solitude and limited social interaction. With appropriate understanding and support, people with schizoid personality disorder can develop coping strategies that allow them to navigate social requirements while honoring their fundamental need for emotional and social distance.